I'm Deborah Sims. I'm a patient advocate here in Melbourne, Australia, and I have been on a new combination therapy for the past 3 years. I was diagnosed in December 2011 at the age of 38. My children were only 7, 5 and 2, and I was told I had an incurable form of leukemia called chronic lymphocytic leukemia, and a subset of that which is small lymphocytic lymphoma. So I had a lymphoma version of a incurable leukemia, and I had chemotherapy a year later after a period of watch and wait, or watch and worry as we patients like to call it. And after that I relapsed, and in 2015 I moved overseas to get on a clinical trial of Venetoclax and obinutuzumab, so a monoclonal antibody and a new novel therapy, neither of which I could access in Australia. I could not believe that I had to leave Australia to get the best drug for me that my doctors wanted me to have. And I had to leave my children, I had to leave my job, and I had to set up a home again in London. It was a huge financial burden and emotional burden. So while I'm very, very grateful that I got one of the trial places and I honoured the agreement to stay on trial for the entire period, which was 3 years, and I commuted between Melbourne and Australia for 10 months, one time a month for 10 months, and then every 3 months ever since. It's been tough. It's been very, very tough, and it breaks my heart that patients are still having to do this and they're not being able to access these drugs in Australia. Yeah, their father and I made the decision very early on, when they were only 7, 5 and 2, and I'd just been diagnosed, that we would tell them I was sick because I was facing treatment, and obviously they would be aware of me being in hospital a lot. So we told them that Mummy had something wrong with her blood and the doctors were going to fix me. And we never really shared more than that. And there was never the mention that this was incurable, and I wanted them to know that Mummy would be okay. A friend of mine lost her mother when she was in her early teens, and she said to me, please make sure you're honest with the children. She didn't realise her mother was dying. When I moved to England, my 11-year-old, when he was visiting me, threw his arms around my neck and said, Mum, you wouldn't have left us if there wasn't a chance you could die. And it was at that stage that it broke me. I really am sad that my children are growing up knowing that Mummy was sick, and I hope that it gives them the strength in the future to draw on the reserves they've had to find, that when bad stuff happens, they know that they can't control bad stuff happening, but they can control how they deal with it. And I think that's the most important message, is that we need to be honest with our children, but try and protect them at the same time, and that's a very difficult thing to do as a parent. I have been a very vocal campaigner. I'm incredibly well. I have no detectable disease. I've had no detectable disease since 2016. It's now 2018, and I'm making sure that Venetoclax is available to patients. I am campaigning for it to be listed on the PBS, and hopefully that will happen within the next few months. Right to Try has obviously been in the news because in America Donald Trump has signed it into federal legislation, and we do have a form of right to try in Australia through the TGA Special Access Scheme, which allows patients with their doctor's permission to access any drug that has received phase 1 listing, or has been listed after a phase 1 trial anywhere in the world. but it's still very difficult to get these drugs. And the reason I started talking about right to try here in Australia is we all of a sudden had a right to die movement and debates about euthanasia legislation. And I said, hold on a minute, that's all well and good, but why are we talking about people being able to end their lives when we're not talking about them being able to save them by accessing these novel therapies? And there are so many new drugs out there that Australians still can't get. We're almost third world when it comes to listing some of these drugs. For me personally, I want to see Venetoclax listed on the PBS. I want to see other patients being able to take this miraculous drug. And I want patients, whatever their cancer, to be able to access the best medication that there is out there, wherever that may be. So it's a case of us as a patient community saying enough is enough. We need to invest money in these novel therapies, because I shouldn't have to travel to England to access a drug that was invented in Australia. First of all, I would say to other patients, please find a doctor you trust and listen to your doctor. I have a number of doctors on my team, and if any of them had said at any stage to do one form of treatment over another, I would have listened, because I do trust them with my life. I would also say be proactive. I know a lot of patients don't want to know what's out there, but I've spent a lot of time reading haematology papers and joining forums and finding out about clinical trials. And if you're not able to do that for yourself, please make sure you have a family member or friend who is doing that for you, because no one has more skin in the game than you. You need to be your own advocate, and you need to be informed, because otherwise you are not going to have the best outcome with all the will in the world. And the other thing I would say is, please stay positive. Well, please stay positive sounds very glib, but please don't give up hope, because hope is the most important thing in getting through this. You can have your dark days, but know that there are scientists and working out there who are trying to cure your disease, and hopefully are very close to doing so.